How do strength athletes avoid hip impingement during deep squats? Imagine trying to lift a heavy weight while your hips feel tight or pinched. That's a warning sign. Strength athletes who want to squat deep without risking hip impingement focus on smart techniques. Hip impingement happens when the ball of the thigh bone, called the femur, hits the socket of the hip joint, known as the acetabulum. This contact can cause pain and damage over time. To prevent this, athletes need to pay attention to how they move and their body's limits. First, they avoid squatting beyond their natural hip flexibility. For some, going too deep causes bone-on-bone contact, which can lead to femoroacetabular impingement. Instead, they find the depth where they feel no pain and stick to it. Using a wider stance and pointing toes out about 30 degrees helps open up the hips. This position allows more external rotation of the hip joint, reducing the chances of impingement during the squat. Mobility is also key. Improving ankle dorsiflexion, which is how much you can bend your ankle upward, helps knees move forward more easily. When ankles are stiff, hips compensate by flexing more, increasing impingement risk. Athletes often use mobility drills, heel lifts, or special shoes to improve ankle movement. Strengthening the muscles around the hips is another important step. Building the gluteus maximus and medius stabilizes the hips and keeps them aligned. Strengthening the psoas muscle, a major hip flexor, helps keep the femoral head centered in the socket. This reduces abnormal contact. Conversely, downtraining overactive muscles like the tensor fascia lati and rectus femoris helps prevent muscle imbalances that could cause impingement. Proper technique also makes a big difference. Athletes focus on maintaining a neutral pelvis and keeping their trunk upright. They avoid excessive forward tilt of the hips and initiate the movement with the hips rather than just bending the knees. Practicing sit or box squats can help find a comfortable, safe position that respects their hip anatomy. Certain exercises can increase impingement risk. Deep sumo squats, lunges, leg presses, and high box jumps are often modified or avoided if someone has a history of femoroacetabular impingement. Understanding individual hip anatomy is essential. Some athletes have variations like acetabular retroversion or femoral anteversion, which influence their impingement risk. Adjusting stance, depth, and technique based on these factors helps prevent joint issues. In high-level strength training, these principles are vital. Pushing for maximum loads and deep squats requires careful attention to mobility, muscle balance, and technique. This approach allows athletes to train intensely while keeping their hips healthy and avoiding painful impingement. Balancing strength gains with injury prevention is what keeps these athletes performing at their best over time.